better outcomes in patients. We can do these surgeries through smaller incisions. So the patients recover faster, they have less pain, and the results are more predictable. So I'll just show you how it works. So typically, this is a model of the spine, and what the robot helps us is get extreme precision in the placement of implants, which helps stabilize the spine and correct spinal deformity. So this is what the robot does. Of course, eventually it will help us in, along with AI, even decide how to give a shape to the spine with the correction. So this was the first one in Australia in 2020. Chairman decided so at that time we robot in one and one
Dr. Hegde and the author team came back and said, listen, there's a spine robot and that's going to make a huge difference. So then we've invested in that. We continue to do spine. The orthopedic team, who I can see Dr. Shankar, I can see Dr. Madan. The lights are on, so I can, whoever I see I'm mentioning, that doesn't mean I'm missing the others. But have clinicians come back and say, listen, this is the latest, this is the best, this is going to make a difference for us. And that's how these things happen with us. I can only say that for us as a country, we need to see we invested in the proton. It was the first, and then one more has come in India. 3 more are coming in India, out of which 2 are with us. But why do we have to invest in this kind of tech? It's only because it's making a difference for the patients, and nothing else matters. It's the patients and it's their outcomes, and that's why Apollo is here to do that. So having said that, ours is the most comprehensive orthopedic program. We can have 1, 2, 3 of the same machines, and we can do that on the cardiac. I'm so sorry, I forgot our cardiac people, both of you are sitting here. Dr. Yusuf has done some phenomenal numbers in the cardiac space. So, the heart has done extremely. Rehan is here, who's again young and, going to do some wonders with us. So I'm just saying that each one of them have done amazingly well. So the cardiac program, ours is probably, Dr. Satyaki in Bangalore, together, they have done the largest of the cardiac work. The Euro and the GI again has now, it's like a proven standard of care that unless you cannot do a robotic option, which is rare, that you go and do conventional, it's actually now it's become the other way. That conventional can do a certain thing, but the people who are experts on the robotic can actually do it 10 notches, 20 notches better. And that is why it is recommended, because it gives great outcomes. And the same is for whether it's ortho or spine or any of these other areas. And almost every system, every frontier has been surpassed with the robotic interventions by all of them who are sitting here. But what is exciting and what is the future, and we have not taken our eyes off the ball, is trying to see how can we use it for brain surgeries, how can we use it for neurosurgeries. I don't have an answer yet, but that does not mean that we're not looking at those aspects. What is going to be exciting, good and futuristic for us, that all the work of everyone who is here will then help people with making better equipment, using it better for AI, because their data and the research volumes which they have all generated as groups has again been phenomenal. So I'm just looking forward to Apollo, India, true Atmanirbhar, making a mark on the global stage. And while I'm saying Atmanirbhar, I'm also very proud that now we're made in India robots. And they made in India drones, they made in India robots. So what more can we ask for? That we're all very proud Indians, and we have products which are as good, if not better, made in India. We have talent which is completely made in India. Maybe they pick up some ideas or something from the Western countries. But what I have learned of late is that people from other countries come to us for training. They ask them and they train them, and that's happening a lot. So truly speaking, I think we are shining as a country. We're very proud to be Indians, and it's members of the media who really have to tell the rest of the world. So when you talk about it, the rest of the world knows that we are really the best in what we do. It's not been easy to take a position in the world's economy, and we are definitely going to be the third largest economy. We will become the second largest economy, and when we become the first largest economy, let's hope it happens in our lifetimes. So I think that is what we have to look forward to. Thank you all for being here, and my heartfelt gratitude from the entire Apollo family for all our clinicians. I'm just so overwhelmed by the number of you, so I may not have mentioned everybody, but I would have loved to have done a roll call for each one of you to thank you for the amazing work you all do selflessly and tirelessly for the institution, and more than anything else for the patients. Thank you all, and God bless.
அனைவருக்கும் வணக்கம். சென்னையில் இருக்கிற ஹாஸ்பிட்டல்ஸ் தமிழ்நாட்டிலேயே நம்பர் 1 in robotic surgeries. அதுதான் உங்களுக்கு அப்போலோ ஹாஸ்பிட்டல் சென்னையில 5 ஹாஸ்பிட்டல்ல 11 ரோபோட்டிக் சிஸ்டம், 18 ஸ்பெஷாலிட்டியில மோர் தென் 50 சர்ஜன்ஸ் இருக்காங்க. இதெல்லாம் பாத்தீங்கன்னா வயிறு மாதிரி சர்ஜரி பண்ணி தான் ஆபரேஷன் பார்க்க முடியும். இப்ப தைராய்ட்ல இருந்து ஹார்ட் சர்ஜரி, லங் சர்ஜரி, எலும்பு மூட்டு அறுவை சிகிச்சை, ஸ்பைன் சர்ஜரி எல்லாத்துக்குமே ரோபோட்டிக் சர்ஜரினால இப்ப ஆபரேஷன் பண்ண முடியும். எதனால இது மாதிரி பண்ண முடியுதுன்னு கேட்டீங்கன்னா 15-20 வருஷத்துக்கு முன்னாடி அப்போலோ ஹாஸ்பிட்டல் கம்பெனி சென்னை ரீஜன்ல we have started investing on talent, bringing in talented surgeons. ரோபோட்டிக்ஸ்னால நிறைய அட்வான்டேஜஸ் இருக்கு. பேஷண்ட்ஸ் வந்து சீக்கிரமா வீட்டுக்கு போக முடியும். பிளட் லாஸ் சர்ஜரிஸ் சர்ஜன்ஸ்க்கும் இட் கிவ்ஸ் அடிஷனல் பவர். எந்த ஆபரேஷனுமே அவங்களால முடிக்க முடியும். அது மட்டும் இல்லாம ரோபோட்டிக் ஆர்ம்ஸ்னால பல பகுதிகளை ஈஸியா அவங்களால அக்சஸ் பண்ண முடியும். ஒரு 30 வருஷம் பாத்தீங்கன்னா, ஒரு 30 வருஷத்துக்கு முன்னாடி பல சர்ஜரி ஓபன் சர்ஜரியா இருந்தது. அதுக்கப்புறம் லேப்ரோஸ்கோபி சர்ஜரி வந்தது. இப்போ ஃபுல்லாவே மெஜாரிட்டி ஆஃப் த சர்ஜன்ஸ் பாத்தீங்கன்னா ரோபோட்டிக் சர்ஜரினால பண்ண முடியுது. நிறைய அட்வான்டேஜ் இருக்கு. ஸ்காருமே இல்லாம இருக்கு ஆக்சுவலா. இதுதான் மேஜர் அட்வான்டேஜ் ரோபோட்டிக் சர்ஜரியில. அப்போ ஹாஸ்பிட்டல் லாஸ்ட் ஒரு 15 வருஷத்துல 8000க்கும் மேற்பட்ட ஆபரேஷன்ஸ் பண்ணி முடிச்சிருக்கோம். இது காம்பேக்ட் சர்ஜரி வச்சு இது 11 ரோபோட்டிக் சர்ஜரிஸ். ஸ்பைனுக்கு தனியா இருக்கு, ஹார்ட் அண்ட் லங் அண்ட் அப்டோமினல் சர்ஜரி தனியா இருக்கு, ஆர்த்தோபெடிக் சர்ஜரி தனியா இருக்கு. 3 டிஃபரெண்ட் கைண்ட் ஆஃப் ரோபோஸ் 11 ரோபோ வச்சு இவ்வளவு சர்ஜரி பண்ணுவோம்.
Thanks.
Thank you.
Thank you.